Again, today we're going to be talking about play attention and how we can customize plans to improve executive function. And as I look through this list, I see that there are many of you who have attended past webinars. And if you've come to our past webinars, you know that we typically address areas of executive function like organization, social skills. We have discussed task initiation. We do special webinars on rejection sensitivity, dysphoria. We've done lots of different webinars that cover key topics. And during those webinars, we always give you tips and strategies that we want you to take away with you. And, tips and strategies are good, but at some point, we have to get to the root cause. We have to really develop a plan to develop and strengthen certain cognitive skills. So, all of those tips and strategies we provide make sense and they can actually benefit you. Because a lot of the clients that I talk to, especially my adult clients, I have one particular client that I'm thinking of right now, and I use her example a lot because she said to me, everyone keeps looking at me and saying, just make a to-do list. Just start your day with a to-do list. Like that was going to help solve everything. And I know that that's, one of the strategies we sometimes say is use a to-do list. And she said, but I know how to write a to-do list, right? I start every morning and I write down my to-do list. The problem is not writing the to-do list. The problem is at the end of the day, I haven't completed anything on the to-do list. Can anyone relate? You can use the raise your hand icon or type yes in the chat box if you can relate to that. Many of you can. And so it is so common. And you think, well, why? It sounds like it should be so easy. Why isn't it? And that's what I'm talking about when I say we have to get to the root cause, right? Because if you think about all of the skills you need in order for that to-do list to benefit you, first of all, you have to remember you have a to-do list. So we have to improve memory so that you remember you have that to-do list and you need to refer to that. Then we also have to work on your ability to sustain your attention so that when you start with the first item on that to-do list, you can sustain your attention. You can initiate that task, sustain your attention on that one task until you complete it. So we have to work on sustaining attention and working on one task until you complete it. We also have to work on impulse control so that you don't start with number one and impulsively jump down to number three. We have to work on filtering distractions so that, again, you're not working on a particular task and suddenly get distracted by other things in your environment. So those are a lot of skills when you think about it. It's not just writing a to-do list. You have to have strong memory. You have to have attention stamina. You have to be able to control your impulsive nature, and you have to filter distractions. And these are all skills that we can help develop within play attention so that all of these tips and strategies you have in your toolbox are going to work for you. And you may see this with your children or your students as well, because a lot of times, if you have a child or a student with ADHD, they probably have a 504 in the classroom. And those are a series of accommodations that we're going to make in the school. And those are good. We want them to have accommodations to help them be successful. However, again, the difficulty comes if we're not simultaneously developing skills, then those accommodations may not be as effective. And some of you here may be seeing that with your children. And I was a classroom teacher, so I know that one of the most common accommodations we would make was longer test time, right? We would give them longer time to complete the test. The difficulty was that we weren't simultaneously teaching them how to sustain their attention to the test. We weren't teaching them how to process the information so that they could get the information from their head and get it down on paper. We weren't working on filtering distractions so that they were able to stay on task during that test. We weren't working on impulse control so that they weren't just rushing through the test. So, a lot of times, longer test time just ended up being longer time to daydream. And you may be seeing some of that with your children who have accommodations and wondering, well, we've put all of this in place. Why is he still struggling? And that's because, again, we have to get to the root cause and help develop skills. Then those accommodations can really be beneficial. So that's what we're going to talk about today. And, we specialize in one thing. We help you reach your goals. So why don't you type in the chat box now? What are your goals? You're all here for a reason. You showed up to this webinar because you have a goal in mind. So if you would type in your goals so we get a better understanding of why everyone's here. And I bet you'll be surprised that many people are here for the same reason you are. So are you here because you're an adult and you want to be more productive at work? Or perhaps you're an adult and that raise or the promotion seems to be eluding you, even though that you know that you are capable of doing a higher level job? Are you watching your child who is really bright, but she's struggling just to get homework done? Why are you here today? Are you a clinician, perhaps, or a teacher, and you want to help your clients or your students really reach their goals and develop strong executive function? Laura says, I'm starting a new SLP, speech language pathology job involving lots of pediatric and play therapy. Excellent. And we have a lot of SLPs and OTs who actually incorporate play attention into their program because, of course, a lot of times your clients are going to need not only the therapy that you provide, but the cognitive skills that may be weak because of attention difficulties. Pete says, overcome procrastination, develop routines to get started. Excellent. And Pete, I think you might have been at our procrastination webinar last time. Amber says, help my son with his executive function and handle his emotions. Let me see, I might be missing the whole name. Sequela says, and as an adult, most of those issues I have during work hours, so I need tools that will help me. Excellent. Hilda says, I want to help with my adult students with disabilities. Kimberly, I'm an adult who wants to be more productive for my health and well-being. Elaine has a difficulty starting a task. Eileen is a school psychology student here to learn more tools for school students. Excellent. I'm a registered psychotherapist from Canada and would like to integrate play attention into my practice. Great. Laura says, I currently work as an SLP working with adults with acquired brain injuries, so become a huge fan of all things executive function. Excellent. And we have worked, there are a lot of reasons, there are a lot of factors that can really inhibit executive function. And so one of which is a traumatic brain injury. And so we've worked with a lot of individuals who are experiencing a loss of cognitive skills due to injury. Andrea, improve my executive function and stop working so hard. Tools for work and home. Excellent. So a lot of you here are because you want to help yourself develop skills, and you know what we know through neuroplasticity, that the brain is moldable, it's shapeable. And if we provide you with the right tools and the right challenge, you can develop these skills despite your current wiring. We know now that age is not a factor. We also know that labels like ADHD are not a factor. If we provide you the right challenge, you can create these new neural pathways that are required for strong executive function. And that's what we specialize in. We can customize a program to help you develop skills. And we were the pioneers in neurocognitive training back in the early 90s. It was our founder of our company, Peter Freer, who started researching different attention training techniques that were being used in the late 80s. And he came across the work that NASA was doing with their pilots and astronauts during their simulator training. They found that they were actually monitoring the brain states of the pilots and astronauts while they were doing their simulator training. And so that means that when they were in the simulator, they were monitoring the brain activity of the pilots and astronauts. And if they were very attentive, then their job was very easy. All of their controls were very easy to use. They were on autopilot almost. But if they got distracted or stressed, or they just were getting fatigued, they weren't as attentive, then all of their controls became very sluggish. Their job got harder. So he thought, our founder of the company thought, that's brilliant, right? If I can provide my clients real time feedback regarding their attention and integrate that with skills they need every day, then I have a comprehensive program. So that was the very foundation of Play Attention. And what makes us unique and effective is what we teach and how we teach it. So Play Attention is the only program that integrates feedback-based technology with cognitive skill training and behavior shaping to provide you with the most comprehensive approach available. So if you see on the screen, you see our body wave armband, and this is an example right here on the screen. On the back, there are 3 sensors. Now, when I slide this armband on my arm, those sensors are now monitoring my brain activity that tells us how attentive I am. And then that information is given over to the computer where I'm allowed to control all of the cognitive exercises just with my mind, or more specifically, my attention alone. And I receive constant and immediate feedback as to whether or not I truly am focused and paying attention. And that's a really important first step in the learning process. Because right now, if you are looking at your child, let's say, or your students, and they are struggling with attention, and you look at your clients or your students and you say, I really need you to pay attention. What do they typically say back to you? If you look at your child or your clients or your partner and you say, I really need you to pay attention, what do you typically hear back? Type it in the chat box. I want to see if you're hearing the same thing that I was hearing as a teacher. Right. Okay. Exactly. Andrea says, I am. Sequela says, I'm trying to. Good. Nalia, Betty. Excellent. Many of you are saying what I used to hear. I am, right? I am paying attention. And a lot of times they think they are, but they just haven't developed what it takes for them to stay very attentive to low stimuli for long periods of time. So, what we're doing is we're taking that very abstract concept and we're making it concrete and controllable. So they actually see their attention in real time. They feel what they're doing and they're allowed to practice. You know, most of the time, we are experiential learners. If you think about yourself or your child or your students, most of us are experiential learners. We give you an experience and you learn from it. Unfortunately, we typically try to teach attention through lecture, right? We say, sit still, eyes on me, pay attention. And we try to tell them what to do. But now we can provide an experience. And that is really critical in the learning process. So this means that all of our cognitive exercises are brain enabled. So when we are talking about all of those skills we need in order to have strong executive function, like sustained attention and filtering distractions, if you are working on those exercises, you have to be actively engaged because you activate each exercise by your attentive state. Because remember, you'll always be wearing that body wave armband during your play attention sessions. So you're activating each exercise with your mind alone. And the reason we do this is because we know when we talk about improving executive function, we're talking about sparking brain change. And there are very specific catalysts you need to have in place in order to spark brain change. One of which is attention, right? You can have a great counselor, you can have a great life coach or teacher, But if you're having a hard time paying attention to that individual or that process, it's very difficult for you to get maximum benefit. So, one of the very first catalysts necessary is attention. So, we incorporate that attention feedback into all of our exercises. That means when you put that body wave armband on, we're looking at your best ability to pay attention, and the bar is set there. If you're able to reach or exceed that level of attention, then you're able to activate the activity or you're able to move the screen character in the right direction. If you start to get stressed or anxious or you're daydreaming, whatever it may be, you're distracted, you aren't as attentive, immediately that activity will stop or the character will go in the wrong direction and you have to focus back in order to continue. So, really powerful. We're incorporating that feedback training with specific cognitive skills, just like the NASA astronauts and pilots were integrating feedback technology with their simulator training. The next area is challenge. We know that if you come into a situation and you are 100% successful, you're not going to learn anything, right? You've already mastered it. So we have to provide some challenge. So remember when I said you have that body wave armband on and we set the bar there at your best ability to pay attention? If you're able to reach or exceed it, you're able to activate the exercise. Now, if you're able to maintain that level of attention for a given number of seconds, then in the background, we raise the bar just a little bit. Now you have to be that much more attentive in order to be successful. And that is very critical. So now we have that built in challenge. The opposite is true too, because I know a lot of you are sitting here today thinking, but my daughter's already frustrated at school or at home. I don't want this to cause frustration. And we know that's true. If you're frustrated, you're not going to learn anything either. So that's why we have that auto adjust algorithm. If we've challenged you and now you're getting a little fatigued or you can't reach that same level of attention, then we're going to bring that bar down to the last successful level and gradually build you up. So we're always keeping you at a challenging yet success-based pace. And then we have deliberate practice. That's the third catalyst necessary for brain change. That means you don't just come into your play attention session and go through the motions. There are specific goals that you're going to have to reach in order to earn your points. And those goals are set by sheer genius, our artificial intelligence. So our artificial intelligence is always tracking your progress and then setting mini goals based on it. So let's say that Andrea is working on time on task. And at the end of the exercise, it says, Andrea, today you were paying attention 44% of the time. Okay. The next time she logs in, it'll say, Andrea, yesterday you were 44% attentive. Today, let's try 46%. And if you earn that, you earn a point. And then the point goes into a reward system. So all of your data is tracked for you. And we're going to use that data to set a deliberate practice model. So attention, challenge, deliberate practice, all of the catalysts required for brain change are incorporated into play attention. I wanted to share Charlotte's response as to why she's here and what her goals are. She said, I'm a senior and the pandemic had a real negative effect on me. My ADHD symptoms have gone wild. And I think what she's bringing up is so important for us to keep in mind is that there are many factors that influence executive function, right? And can exacerbate ADHD symptoms. And the pandemic really did seem to have a negative effect on many people's executive function. But again, like we said, Charlotte, as long as we provide a systematic way to help you develop these skills, you can create those new neural pathways. Now, we've been doing this integration of feedback technology with cognitive skill training and behavior shaping for about 30 years. But Tufts University School of Medicine wanted to know, is that integration important? Or can we simply give you a series of cognitive exercises or what you hear a lot about as brain games and get the same results? So they went into the Boston Public School District and they had three different groups of students, all identified as ADHD. The first group received play attention, so they had full integration. The second group received just cognitive exercises, so brain games on the computer, no feedback technology, and no behavior shaping. And the third was their control, so they received no intervention at all. And at the end of the study, the play attention students were the only students that showed global improvements in all areas, including academic, social, behavioral, and executive function. They were also the only students that if they started the study and they were on medication, because some of them were on, some of them were not. But if they were on medication and in the play attention group, those students had an average decrease in their medication, where the other two groups had an average increase. And that goes back to skill building. If we can help you develop the skills that you lack, there may be less of a necessity to mask symptoms. So you can use play attention, whether you're on medication or not on medication. Medication works for many people by controlling symptoms. The difficulty is that medication doesn't teach any skills or change behaviors. So we don't want to medicate and fail to educate. We want to really use this time to help you develop skills. And that's what play attention can do. Play attention can teach the skills that medication alone cannot teach. So great studies. If you do want to review those in depth, just type in studies or Tufts, and I'll make certain that you get those as well. Let's see. Azim says, is neurofeedback is based on EEG. So yes, we are monitoring EEG. That's correct. Now we're a bit different than clinical neurofeedback, right? So if you've gone to a clinician and you've done clinical neurofeedback, when you go into a neurofeedback clinic, they believe that ADHD is caused by brainwave dysregulation. So they think if they fix the individual, or they're coming from the they're coming from the standpoint that if you fix the brainwave, you fix the individual. So they'll say, we're going to decrease theta, we're going to increase beta, and that's their focus. The difficulty is that it's very difficult to transfer and generalize the skills you're learning, right? Because you can change a brainwave, but that doesn't necessarily mean your child's going to get his homework done on time. It doesn't mean that you're going to be able to get through that to-do list, right? It doesn't mean you're going to be more organized or pick up on social skills. When we talk about attention difficulties or weak executive function, attention's just the tip of the iceberg. There are lots of different skills we need to address. And if we're going to develop skills, we have to teach them directly. And so that's why play attention is an actual improvement in that clinical space where we're actually incorporating feedback technology with specific cognitive skill training so that we can transfer and generalize what you're learning. Okay, excellent. Let's see. Sequela, what about women in stages of premenopause? How will these tools work with the fluctuations of estrogen levels and that affect ADHD? You're working them the same way, right? Even though certain levels may fluctuate, you're still developing cognitive control. So no matter what the situation is, you have more cognitive control so that you can utilize these skills across the board. You're strengthening these areas so that you can have better control over those. Okay. Now, you'll see that my student here, he is 28 years old in this picture here, and he's working on one of our exercises called attention stamina. That's his ability to direct and sustain his attention at will, much like being able to pay attention to the teacher in the classroom or your colleagues in the workplace. So I wanted to describe a little bit about that real-time feedback. So you'll see that there's a character in the middle of the screen, that submarine. And you notice that on his arm, he has that body wave armband. Now, when he begins this exercise, that submarine starts at the top of the screen. Once he's focused and paying attention, he's able to push that character down to the bottom of the ocean just with his mind, or more specifically, his attentive state. And then he knows that's what it means for me to pay attention, right? Again, we're providing an experience where he sees his attentive state. Now, if he gets distracted, and distraction can be a variety of things. It could be that he starts to daydream. It could be that he starts a self-distracting behavior like fidgeting. It could be anxiety. Someone walks into the room and he can't filter that noise. Immediately, that character will start to float up. And then he has to control that behavior, control that daydreaming, focus back in order to push it back down to the bottom of the ocean. So we're providing that experience. And just for clarification, I want to take a quick poll here. And please, I just want to make certain that everyone is on the same page. Go ahead and respond to the poll that is on the screen right now. What does this body wave armband monitor? Is it A, eye movement, B, breathing, C, brain activity, or D, FM radio? I just want to make certain that as we're looking at this exercise and talking about it, everyone understands exactly what we're monitoring. If you don't see the poll for some reason, you can type your response in the chat box. Is it monitoring eye movement, breathing, brain activity, or FM radio? Okay, I'm going to Pete says, so you're testing our attention. Yes, I am. Good answer. uh, very good. All right. And I'm going to close the poll in 3, 2, 1. Excellent. What a great group. So 96% of you responded correctly. We are monitoring brain activity, not breathing. All of that noise that occurs from the head to wherever you've placed it on the arm, all that noise, breathing, heart rate, muscle, it's all filtered out. We're only monitoring where attention starts, which is in the brain. So it's monitoring brain activity. So the one exercise I just described, that is attention stamina, teaching you how to direct and sustain your attention. But you see on screen, we have lots of different exercises that we can incorporate into your program. And that's where the customization comes in, where we assess your particular needs. You all, whether you're a professional client or a home client, you will be assigned a personal executive function coach, one of our coaches here on staff, to assist you every step of the way. And that person will initially assess your needs and set up your profile so that we're pinpointing the different cognitive skills that are required for strong executive function that may be weak for you right now, or weak for your child or your students. So that's where the customization comes in. The important thing to remember is that no matter what you're working on, remember they're brain enabled, and our end goal is to improve executive function. It looked like from our initial discussion, many of you are familiar with that term, executive function. So you know it's like the CEO of your brain. It's what allows you to control your attention, your behaviors, your emotions. It allows you to plan and prioritize, organize, avoid procrastination, and remain on task. All of these mental processes that we use every day, they tend to be weakest for individuals with attention difficulties or ADHD. So it's important that we take a step back and develop the skills required for executive function, because no one is born with strong executive function. However, we all have the potential to develop it. And that development starts right after birth and continues through our mid to late 20s. Unfortunately, for a lot of our students, and you may be seeing this in your child today, or you might think back and think, oh, yeah, that's exactly when it happened. Around middle school, around the ripe old age of 12, we expect everyone to have strong executive function. And like I said, that doesn't always naturally happen. There are a lot of factors that can inhibit that development, one of which is ADHD. So, in order to develop executive function, there are certain cognitive skills, and these are the modules that you can incorporate into your play attention program. And I'm just going to summarize what each one looks like. back in the classroom or the workplace or the home, so you can get a better understanding of what you would want to incorporate into your program. So, attention stamina. Again, that's the ability to direct and sustain your attention at will to low stimuli. One of the things you'll notice in all of our graphics, and you may have noticed it when I was discussing my student John, who is moving that character to the bottom of the ocean, all of our graphics are very simple. They're very low stimuli. And the reason we do this is because we know if we give you something high stimuli or high interest, you can hyper focus in those situations, right? Where it's hard to draw you away from it. You have that superpower of hyper focus, and you can really complete amazing things because you have that ability if the interest level is there, right? You may see this with your child as well. You think, how can you play your video games for 2 hours, but you can't get a 15-minute homework assignment done? I know many of you have experienced this thought. And that is because it's a level of stimuli, right? You are wired, or your children are wired to pay attention to high stimuli or high interest. We don't need to teach that. You can do that. What we need to teach is what's more difficult, and that's how to pay attention to low stimuli, much like the classroom teacher or the workplace, where cannot possibly compete. So that's why all of our graphics are so very simple, low stimuli, so that you can learn how to pay attention to that low stimuli at will. The next exercise is called visual tracking. So that's a great one. If you've ever heard from, let's say the teacher has said, he does great when I stand right next to him. But as soon as I walk away, he's out the window and out the door. And then he has that diffused attention where he's paying attention to a little bit of everything. So we work on staying focused and visually tracking. Task completion. This is a huge one. That ability to start a task right away, keep your attention on that task until completion. So that 15 minutes of homework takes 15 minutes and not 2 hours. Or as an adult, it's not, "Oh, I start a million things and I finish nothing." Or I'm so busy, I'm exhausted at the end of the day because I've been so busy, but I finished nothing, right? Being able to start and complete in a timely manner. Short term memory. This is the ability to remember dates, names, facts. Filtering distractions. This is the ability to actually take in different types of stimuli, know what to pay attention to, what's most important, and filter out all of that unnecessary stimuli. Because how many of you here feel like there are a million different TV sets going on in your head all at the same time, right? Because you're taking in everything around you. It's not that you have a deficit of attention. Attention deficit is really a misnomer. The difficulty is you have great attention. The problem is you're paying attention to bits and pieces of absolutely everything. So what we want to teach is how to pay attention to what's important and filter out unnecessary stimuli. And then we work on transfer and generalization, teaching you how to take all of these skills you've learned within play attention and apply them to your real work or homework. And each of those modules that I just mentioned that come in the core, they each come with a beginner, intermediate, and advanced skill option. So there are certain benchmarks you're going to have to reach before moving up to intermediate and then to advanced. And our artificial intelligence sheer genius will actually track those benchmarks and graduate you when appropriate. So when we reach certain benchmarks and we move you into intermediate and to advanced, then we're going to tie in more processes that are required for executive functions, such as processing speed. So if you notice that you yourself, you might be a slow processor, you understand the information. It just seems to take you a little bit longer to process and give a response. That's processing speed. Task switching, that's that mental flexibility, being able to transition from one activity to another. Impulse control, that's the ability to control, obviously, your impulsivity so that you don't make careless errors or act without thinking things through, or perhaps maybe you interrupt people while they're speaking. That's all about impulse control. And distractors, being able to filter those distractions. Kimberly says, and here all along, I thought I had a unique skill, talent to pay attention to everything that was going around me. Well, it is a skill, but it's not unique. I bet a lot of here can relate to that. But it can be good, right? Because sometimes, and I know a lot of you here may be working in, for example, the classroom situation, because I saw there were many educators here. And it's good if you can be aware of everything around you, right? Because there are all these little fires going on around you in the classroom, and you have to be aware of the situation. But then, Kimberly, you have to be able to hone that attention and control it when you need to, so that you're not constantly distracted. Now, the transfer and generalization that I brought up earlier, I mentioned that we're going to teach you how to take all the skills you've learned and apply them. So you notice here, my student is wearing that body wave armband, but she's not looking at the computer exercises. She's actually working on her report. So you can have this body wave armband on while you're reading. Maybe you're doing a report for work or for school. Perhaps you are working on some databasing, emailing, whatever it may be. So you may be working in specific exercises that aren't related to the computer exercises I showed earlier or discussed earlier. You're working on real work. This is where we're asking you to take all the skills you've learned within play attention and apply them. So as long as my student here is paying attention to her writing of her report, she's going to hear from the computer, good, great. If she starts to drift, she'll hear focus, and then she knows she's not in that state she needs to be in order to process and complete this assignment. So this is where we're asking you to take all the skills and apply them. We're teaching you how to apply these skills to real work. And also for you as parents, big sigh of relief because it's no longer you saying, get back on track, right? You're serving as your child's self-monitoring and self-regulation. Now we're teaching them how to regulate themselves. Let's see, Rebecca, please show us examples. How can I keep my son to not change the link? Oh, I see what you're saying. Right. So she's saying, and this is a very common one that we hear, that they do all of their work on the computer or on their Chromebook, and they're constantly clicking to links, right, here and there. And so in order to make certain that he's able to sustain his attention and not click those different links, that's related, Rebecca, to impulse control. So when we get into those intermediate and advanced skill options, we're teaching you how to sustain your attention and control that impulsive nature to click to other things, right? He's looking for that stimuli, that instant gratification. We're going to teach him how to sustain his attention and control that impulsive nature. Very good question. Excellent. So Michael, that's a really good question. Let me get through these and I'm going to go back to that, okay? So also, in addition to those initial modules that I mentioned, we do also have a series of masterclass modules that you can pick and choose and incorporate into your program at any time. One is working memory, and working memory is very different from short-term memory in that short-term memory is remembering information for 15 to 30 seconds and giving that information back in the same manner. So if we were at a conference and I said, hello, my name is Gwen, and you said, hi, Gwen, that's short-term memory. I gave you information, you gave it back to me in about 15 to 30 seconds in the same manner. Working memory is that higher level thinking skill. And that's the ability to take in information, hold that information on your mental sticky note, and then use that information to complete a task. So it helps with reading comprehension, upper levels of mathematics, problem solving. For us as adults, it's that classic, I walk into a room, and once I get into that room, I have no idea why I'm there. I know I went in there for a reason, but now I don't know why. That's a lapse in working memory. Auditory processing, that's the ability to follow through with multiple step verbal instructions. So if you say, go to your room, put away your sneakers, bring down your jacket, that's and and you have to constantly redirect and remind, we need to work on auditory processing. Hand-eye coordination is all about small motor control. So, for example, handwriting. Social skills is a great one. If you have any difficulty picking up on social cues, you miss the look, you miss the shake of the head, so it appears that you respond impulsively or inappropriately, social skills is a great one to develop that ability to pick up on social cues. Spatial memory, if you're constantly losing your keys or your wallet or your phone, your child is constantly losing his shoes or his backpack or his socks, that is spatial memory. Mental math, Alyssa said, that's me. Exactly. That's a lot of people here today. Mental math is for our younger students, first grade addition, subtraction, second grade addition, subtraction, memorizing those math facts. Mindfulness. This is so important. And one of my favorites that we have here. I recommend it for everyone who has a lot of anxiety or a lot of internal dialogue that's derailing you. Because mindfulness, we always hear how mindfulness helps with the symptoms of ADHD. And that's true, right? However, we can't look at someone with ADHD and say, now I want you to practice mindfulness, because mindfulness is hard. It's hard for all of us, especially if we have that running mind. So what we do is we give you a visual representation of what it means to be in the present moment. So you'll actually see a lotus flower in the middle of the screen. Once you have your mind in the present moment, you're able to start opening that petal on the flower. If you start thinking, when's my next meeting? Who do I have to call? When do I have to pick the kids up? That petal will start to close because you're no longer in the present moment. And then you have to bring yourself back in order to continue. So we're enhancing your mindfulness practice by giving you a visual representation. And finally, motor skills. That's more of the gross motor control. So if you have more bumps, bruises, accidents than your peers, that's a great one for you. Now, this brings us back to Michael's question as far as how do all of these exercises help me improve executive function, help me improve my ability to organize, prioritize, initiate tasks, improve my emotion regulation. And that's the end goal, right? And you don't see organization or emotion regulation in this list. But if you think about any of those mental processes within executive function, in order for you to be, let's say, more organized, well, first, if you have to organize something, a project, you have to be able to pay attention to the entire situation. You have to be able to process that information in a timely manner so you don't miss details. You have to control your impulsivity so you're not just getting parts of the information and just impulsively going and doing one area of that while forgetting others. We have to work on your working memory, your ability to initiate that task right away and stay on that task until you complete it. So attention, impulse control, memory, all of those areas that we address in every single play attention session, you're working on. So every time you do a play attention session, not only are you working on these individual cognitive skills, but you're strengthening all of the skills you need in order to have strong executive function. Rebecca says, do I need to sit with my son, or do you teach us a technique to lock his screen? Oh, well, when you're doing play attention, depending on the age of your child or, if they are having a hard time initially not clicking away and doing something else, then we would recommend that an adult works with the child. And your executive function coach will actually teach you how to work with your child in that situation. Of course, depending on the age, eventually we want to get to a point where we can allow that child to work more independently. So that is something, Rebecca, that you and your executive function coach can talk about, and they can give you tips and strategies in order to make certain that your son has a really effective play attention session. Okay. All right. Now, if we just went through all of those different cognitive exercises. And many of you were saying, like Kimberly and Alyssa, you were saying, that's me when I was mentioning certain areas. But if you aren't really sure what cognitive areas you would like to improve, we do have a couple of assessments available. Now, some of you may have already done neuropsych evaluation and you want us to use that information to help you customize your plan. That's great. But if you are interested in learning a little bit more about your cognitive skills or your child's, then we have two assessments available. One is called Focus, which is a norm reference test of attentional control. It's computer based, it takes 20 minutes, and at the end of the 20 minutes, we receive a full report that tells us how you performed compared to the performance of your peers. And we can use that information to set up your plan. We also have the brief available, which is more subjective, right? It's a behavior rating inventory of executive function, and it gives us a really good snapshot about your daily executive function. Okay, your executive function on a day-to-day basis. Now, the assessments, if you would like to do an assessment, each one takes about 20 minutes. And then we will need about a 40-minute block of time in order to review the results with you and talk about a plan of action. So if you do want to learn more about the assessments or actually register for an assessment, you can type in assessments. Again, it's the focus and the brief assessment. They're typically $50 a piece, but with this webinar special, it's buy one, get one half price. So you can do one or two, and then you can have that 40-minute follow-up to review the results. So if you are very interested in the assessments, just type in assessments and we'll follow up with you to discuss the assessments further. Okay. Now, when we start your Play Attention program, you will receive everything you need in order to have a successful program. First, of course, you'll have that body wave armband that monitors your brain activity. You'll have your customized neurocognitive training program. You have your behavior shaping module, and that will allow us to work on self-distracting behaviors. So if you're working with a child or an adult who has a lot of self-distracting behaviors like skin picking, nail biting, chewing on their shirt, we can actually use this moment and this as a teachable moment in order to teach them how to control behaviors not conducive to good attention. Alyssa, that's absolutely fine. I can reach out to you tomorrow to help you with that assessment process, okay? You'll have your personal executive function coach to help you every step of the way. That coach will take you on a 90-minute Zoom tutorial to make certain you're real comfortable with everything before you start working, and you own the program. So there's no continuing fees. You have a lifetime membership along with that unlimited support with your executive function coach. Now, there are a few things that you want to keep in mind. One is that you want to work consistently. And by consistency, I mean at least an hour per week. So if you are working in a professional setting where you're seeing clients, that's usually 2 30-minute sessions. If you're working at home with yourself or your child or your partner, usually our home clients do 4 15-minute sessions. You spread it out throughout the week. Whatever you decide is best for you. You'll start to see good results after about 6 weeks of consistent training. You'll notice that you are more engaged, you're more productive, your child is getting homework done faster, you're not repeating yourself as much, you're not redirecting. And those are small steps of improvement, right? But what you're not seeing is what's actually occurring in the brain. And that's that you're causing those new neural pathways that we discussed earlier. You are actually having those new neural pathways start to form in the brain. And in the beginning, those networks are weak. That means one day it'll look like they're doing beautifully, and the next day it'll look like they've never heard the word attention before. There's going to be a little bit of up and down. But through the practice and repetition, you're actually strengthening those networks to a point of permanency. And that's our end goal, because we want to know not only will you have these skills now, but you'll have them 20 years from now. And that usually takes about 40 hours total. So if you're working an hour per week, plan on about 10 months of consistent training. but everyone learns differently. So at that 40-hour mark, you and your executive function coach will get together, make certain you're at all the advanced skill options, make certain that everything's transferred and generalized. If everything looks good, we can graduate from the program. If it looks like there's more work to be done, we simply customize the plan and we keep going. As I mentioned, you own the program. So whether it takes you 10 months or 16 months, it doesn't matter. You continue working as long as necessary. And not only will you have that real person, your executive function coach, but you also have sheer genius, our artificial intelligence, who makes a lot of decisions throughout your program for you to make certain that your daily curriculum is set every day. You don't have to decide what to do. You will only work on the exercises that sheer genius says to have. He'll set mini goals for each exercise, track and award your points, manage your reward system, and graph all of your results. So at any point, you can go into your dashboard and you can monitor progress in all of the cognitive skill areas. That's right, Alyssa, gamification. It's important and it's motivating. It works for sure. So you will have all of this at your fingertips. So in order to reach your goals, and if you think back to what you wrote initially when we first started talking about your goals, you wanted to be more productive. You wanted to not be so tired at the end of the day. You want to have more successes and improve social skills. Whatever your goals were that you wrote in the beginning of this session, you can see how we can develop a customized plan to help you reach those goals. And it does take time and consistency. So keep that in mind. We want to work at least an hour per week, but break that hour up and always lean to your executive function coach whenever you need help. Now we have those two programs available. We have the home system, which includes everything we discussed today, the 6 base modules that we discussed, and a user license for 2 people. That means at any one time, you can have 2 family members enrolled in the program. The professional system is the same. However, it comes with an unlimited user license. So if you are running a clinic and you have 25 clients you'd like to enroll tomorrow, you can enroll all 25. There's never any relicensing involved in it as well. So you always have that unlimited user license. And again, you'll have everything you need in order to run your program. And you'll have that unlimited support with your executive function coach. Now, there are a lot of questions still coming in. So just know, I know that we're running short on time. So I'm going to go through the next couple of slides, but I will come back to all of these questions if I didn't get to them right away. Okay? Webinar. Thank you so much. Take care, everyone.